More than the acne, the scars can cause a lot of psychological impact on the patient's life. Acne management not only includes medical treatment, but it also includes dietary management, lifestyle factors, reducing stress levels, and getting into a good skincare routine. There are a lot of treatments, and we have to tailor the treatment depending upon the kind of acne scarring that. Hello, I'm Dr. Shubha Kesari, Senior Consultant Dermatologist practicing in Bengaluru for more than 16 years now. As we all know, acne is a very common problem. More than 80% of the teenagers will experience acne during their teenage years. Nowadays, with the changes in lifestyle and the eating habits, even adult onset acne has also become common. Now, acne is a very universal phenomenon, but what makes it so interesting is that it affects so many people, it causes a lot of scarring, and more than the acne, the scars can cause a lot of psychological impact on the patient's life. So it is important to know how to manage acne marks and scars in an effective manner. As one says, prevention is always better than cure. So prevention of acne marks and scars is the best way to treat it as well. So when one experiences acne, it is best to consult the dermatologist so that they can get the appropriate treatment either in the form of topical agents, oral medication, or even procedural treatment. Once the inflammation of the acne is reduced, the subsequent scarring and the post-inflammatory hyperpigmentation will automatically come under control, and over a period of time, the scars of the acne will also gradually fade. Acne management not only includes medical treatment, but it also includes dietary management, lifestyle factors, reducing stress levels, and getting into a good skincare routine. All of these are necessary to effectively control acne. Now, sometimes, whatever the reason, either genetic factors or hormonal triggers, how much ever we try to treat the acne will result in scarring. Now, there are different types of acne scars that can occur, and they could just be brown spots and marks which have occurred because of the acne. It can also be deficits in the skin tissue, either the dermis or the subcutaneous tissue, which has resulted in acne scars. Now, these can really affect the person's self-esteem, and people would like to do something about it. While most acne scars fade with time, sometimes acne scars stay for long periods of time and require certain procedural treatments in order to manage them. There are a lot of treatments, and we have to tailor the treatment depending upon the kind of acne scarring that has occurred. If it is just brown spots and marks of acne, then along with topical medication, simple procedures like microdermabrasion and chemical peels using salicylic acid or glycolic acid or a retinol peel will help to reduce the brown spots and marks. But if there is deficit in the dermis, there is scarring, then more intense treatments may be necessary. Now, the treatment has to be tailored depending upon the type of acne scar that the patient has. There are different types of acne scars. It could be ice pick-like scars, it could be shallow rolling scars, or it could be even deeper box scars. Some of the acne scars could be papular scars, which are outward projections of the skin, and very unfortunately, sometimes, rarely, people may develop even keloidal scarring. After examining the individual, we have to decide what is the percentage of scars that is present, grade the degree of acne scarring, and form a treatment plan for that individual. Acne scarring, unfortunately, only one process of treatment will not work because there are so many different types of scars. Usually, combination treatments or sequential treatments give the best possible results. For grade 1, grade 2 scarring, microneedling would be a good option. Now, what do we do in microneedling? Basically, needles enter into the skin. They kind of cause micro injuries, which will stimulate the skin own healing processes. So, this will give better results and improvement in the appearance of the scars. Fractional CO2 laser also helps, wherein beams of heat energy are delivered into the skin to stimulate the skin's own collagen fibers to form new collagen fibers, which will gradually heat up the scars. Microneedling radiofrequency, in addition to injuring the tissue in the form of small needles, also delivers heat energy into the tissue, which will increase the quantum of collagen formation and give very good results. Now, these procedures can actually combine even in the same sitting. If the degree of scarring is more, if there is holding of the upper surfaces of the skin, then subcision to release the scars from the lower surfaces has to be done, and it will help to elevate the scars as well. If the scars are very big, then acne surgery treatments like punch elevation or acne punch excision can be done to give the best possible results. Now, as I said, multimodal treatment has to be adopted. In addition to these laser treatments, microneedling radiofrequency, we can also do some regenerative therapies like PRP injections and growth factor injections, wherein the power of the growth factors of the patient's own blood is harnessed. It is injected into the skin in order to release growth factors, which will initiate regeneration of the skin fibers, which will gradually help to heal the scars and fill up the scars. So, a multimodal acne therapy is always the best form of treatment. Please consult your dermatologist, get yourself examined, and have realistic expectation. Definitely, the appearance of acne scars with the combination of treatments can be significantly reduced. For people who want instant results for their acne scars, we have a lot of patients who come just before their wedding and within 3 months they wanted to settle. All the procedures that I have stated before are multiple sitting based procedures. Each sitting is done at an interval of 1 month. So the total duration of the treatment is anywhere between 6 to 8 months, and for the results to be seen it may take up to a year. But for people who seek instant results, we have a quick fix procedure, which are dermal filler injections, wherein we inject the hyaluronic acid into the scar tissue, which will help to fill up all the craters and give a more uniform appearance of the skin. However, the hyaluronic acid, because it's a natural ingredient of our skin, over a period of time gets broken down and dissolves. So it lasts the good effect, and the result that you have got will last only for about a period of a year or so. A more long-lasting solution probably would be a structural fat grafting, wherein fat from the patient's own body is taken as something to fill in the volume loss and fill up all the craters of the scars. This will last for a much longer period of time and also give you the maximum improvement. Now, whatever is the procedure that you undergo for acne scars, it is necessary that you have to follow certain post-procedure care. These procedures are something that will make your skin a little sensitive to the sunlight. So, protection from the sun is mandatory. You should use mild products which do not contain a lot of actives initially after undergoing the procedure for at least a week or so. Very strict application of sunscreen, and to avoid all kind of home remedies or parlor procedures for about a week after the procedure is done. Once the procedure is done, it is necessary to maintain the skincare routine so that you do not get a fresh bout of acne, as whatever scars have reduced have to be maintained. Now, people should have realistic expectations when they undergo acne scar treatments. How much ever we dermatologists wish, we cannot unfortunately erase the scars completely. All these procedures, combination of treatments or sequential treatments that one undergoes will be able to reduce the appearance of the scars by around anywhere between 50 to 80% depending upon the patient's skin's response. Each patient responds to the procedure in a different manner, and maintenance of the skin is also necessary in order to maintain the results of the procedure. So one should have their expectations aligned. While we can give results, we cannot completely erase the acne scars. Prevention is always better than cure. So treat your acne early so that you can prevent the scarring, prevent the marks. If there are acne marks and scars, do not hesitate to consult your dermatologist, as we have lot of procedures available that can give you very strong, long-lasting and satisfactory results.